There are so many seemingly unsolvable causes of human suffering. People all over the US struggle with chronic pain, epilepsy, anxiety, PTSD, autoimmune conditions, movement disorders, insomnia, chronic nausea, wasting syndrome, and opioid addiction. It may seem impossible to solve all of these issues with the current medical technology we've developed, but an answer might be right in front of our eyes. Unfortunately, this potential miracle is unavailable to so many of those who need it most. This is because medical marijuana is still illegal in 14 states, and federal legislature complicates the prescription, research, and pharmaceutical production of cannabinoid drugs. Some argue that illegal drugs should never be prescribed because their regulation was put in place for a reason. However, the history of marijuana restrictions in legislation is lacking in scientific evidence. Many conventions criminalized marijuana on moral or religious principles rather than practical application. According to journalist and historian Dr. Stephen Siff, public disapproval of marijuana was a direct result of a pattern of over-sensationalized media in the Prohibition era. The emotional claims of the evils of cannabis began after pipe smoking was introduced by Latin American immigrants. Prior to this, marijuana was more commonly found in the U.S. as a liquid, over-the-counter medicine. Journalists and lobbyists claimed that marijuana caused violent episodes, homicidal urges, and death. Due to the lack of empirical data on marijuana and the push from religious prohibition groups, these claims were never questioned, and marijuana was criminalized through a series of laws spanning the next 10 years. Each national bill had shockingly short debate times in the House. The legislative misunderstanding of the THC was so clear that during deliberation for the Marijuana Tax Act, the Speaker of the House, Sam Rayburn, had to clarify to another House member what exactly marijuana is. Unfortunately, he said, on record, that marijuana is a narcotic of some kind. This and many other assumptions about marijuana are blatantly false. Due to the 1970s War on Drugs campaign and programs like DARE, many Americans do not question the idea that cannabinoids are extremely dangerous. Current legislation should be assessed for factual integrity and functional purpose. One significant concern is that American governing bodies claim that marijuana is equally as harmful as other Schedule I drugs like heroin and ecstasy. Schedule I status also indicates that there is no medical use for marijuana derivatives. However, this is blatantly false. Therapeutic doses of marijuana do not cause significant neurological damage or encourage violent behavior. The primary health concern for marijuana use is smoke inhalation, which can be avoided in any treatment plan. In fact, according to the Review on Cannabinoids in Health and Disease, published in the Clinical Neuroscience Journal, the side effects are generally benign, and overlooking the therapeutic value of cannabinoid drugs is unacceptable. I have personally witnessed the harm of this in the medical treatment of my mother. She has several autoimmune disorders, chronic pain, and Parkinson's. I've watched her suffer on a daily basis with no potential pharmaceutical intervention from doctors. As the days went on, her immune system caused more and more internal damage, and her symptoms worsened. She was prescribed opioids for her pain, Parkinson's medications for her neurological symptoms, anti-nausea medications for her persistent appetite disruption, thyroid medication for her organ damage, and a host of other pills to treat the side effects and conditions. All these competing medications took a huge toll on her system and finances, all without truly managing her symptoms. Ironically, THC and CBD could potentially soothe nearly all of her issues and eliminate the primary cause of her stress. But since marijuana is so stigmatized and criminalized, she does not have the option to try this life-altering treatment plan. Her sister, who shares some of her genetic conditions, has tried some of the therapeutic THC treatments that are legal in Maine, and has had an almost complete elimination of her symptoms during the day. A change like that is significant enough to be considered a miracle. In the U.S., there are so many people like my mom who are trapped in an unnecessarily difficult life just because they cannot try the less harmful treatment. This needs to change. In order to make this change possible, we each need to self-evaluate and consider why marijuana is illegal, and if we truly support the criminalization of medicine. Additionally, we should consider whether scientists and medical professionals should be prohibited from developing and carefully testing new medicines from THC and CBD extracts. Ethical progress cannot be made without legal access. Progress is hindered even in places where medical marijuana is legal because developers and practitioners have too many restrictions. This graphic was compiled from a survey of Minnesota oncologists on the challenges they face prescribing and researching THC treatments. Access to emerging medicine is essential for cancer patients, and according to the American Cancer Society, cannabis is one of the most promising. Its role in relieving symptoms of chemotherapy is indisputable, and there has been success using THC to slow the growth of cancer in both lab and animal trials. More research should be done, but progress is hindered by legal status. Scientists and patients will not have enough access until things change. If you believe that Americans should have access to the best possible medical care, support the legalization of medical marijuana. If you believe that people and their doctors have the right to determine the best course of action for their body, support legislation that decriminalizes cannabinoid drugs. If you want to help people like my mom, support the MORE Act. This is one of the most comprehensive pieces of potential marijuana legislation currently proposed. One easy way to support this act is to go to mpp.org and scroll to the bottom of their page. You can fill out their easy draft to Congress to show your support as a citizen. You can also donate to MPP to help in their advertising and legal action for the legalization of marijuana. Please come to your own conclusions. You can refer to the description for more information. There are sources and links for further research.